Hi, this is Peter Prop, and welcome back to HealthGlobe Insights. And this is our video series with Jeff Carter. He's the CEO and co-founder of HealthGlobe. I'm Peter Prop. I'm the Chief Marketing Officer, and what we're trying to do is get together on a regular basis and talk publicly about the things that we talk about in private. There are a lot of very exciting trends going on in the industry, and Jeff is on top of most of them, and I'm following many of them as well. Um, so, Jeff, thanks for joining in today.
Thanks for having me.
And today we're going to talk about the use of medical travel and use of HealthGlobe to procure executive medical screenings for companies that are doing a self-insure plan. So, Jeff, why don't we talk for just a minute to set the groundwork? What's the difference between an annual physical and an executive medical screening?
Well, there can be a little difference or a lot of difference, and that's kind of one of the one of the decisions that the employer makes in the implementation process is how what level of screenings will be provided to employees. So sometimes they can be up to and including radiology testing, body scans, things like that. Other times it's simply much more thorough blood testing and physical examination. So there are a whole number of options that can be incorporated into an executive health screen. But in every case, you get a lot more individualized attention and a lot more health and wellness information, really, to sort of guide your choices in the long term to create better long-term health for yourself. And as an employer, it's an opportunity to provide good information and better long-term health for your employees.
Excellent. So, so if you are a a corporation or organization institution that obviously has to provide um, health coverage, you could opt to provide just an annual physical. But some companies are choosing to, for probably not a whole lot more money, negotiate through HealthGlobe to to procure and deliver executive level medical screenings for all their employees. Is that right?
Instead of or in addition to,
Right.
either way. But yeah, it's definitely a good way to start, giving your employees more information about their health. I mean, a lot what we're hearing a lot of, pretty much across the board is that health benefit programs are focusing a lot more on wellness aspects and on long-term health,
Mm-hmm.
uh, so that so that employees are more productive, they work better, they work longer, but also healthcare costs are much lower when you have a healthy employee base.
Right.
So wellness is really just a spectacular long-term investment in your employees, both personally and financially. So really, that's more or less the driving force behind offering executive health screenings. And you have to start somewhere. Some groups will start with smoking cessation. Some groups will start with with exercise programs. You can start with an executive health screen in order to give your employees a framework for what their current health condition really is and what they can do to make it better.
Right. And we were talking the last time we got together about the idea of companies who self-insure, who want to start getting in the idea of um, medical travel benefits that might be domestic or overseas. And,
Exactly.
and that what we're really trying to get into is this idea that by traveling across a state line or across an international border, you might be able to improve the quality of your health and deal with a health concern at a reduced price, and that would be beneficial to everybody. And so, this idea of offering executive medical screenings is another example of an initial benefit that a corporation or institution could provide to get people more comfortable with the idea of medical travel.
That's exactly right, and we've got a uh, whole list selection, if you will, of different levels of screening, different locations, both domestic and international, and they can be offered individually or as a whole spectrum of choices for the employee.
Excellent. Well, Jeff, I think we've about covered this. Um, I guess the takeaway is, as you consider ways to improve the quality of the health of your employees and improve your bottom line, uh, implementing a medical travel benefit and starting it off with an executive medical screening program could be a very cost-effective way to get involved in that sort of a program.
And to take the long view on wellness as well. Yeah, absolutely.
Exactly. Well, yeah, because the long-term cost savings of healthy employees and retention, it's really almost impossible to calculate that. But retention and health is a good way to keep your company moving forward in a good direction.
Absolutely.
Excellent. Well, Jeff, thanks a lot for your time, and we'll see you back soon.
Thank you, Peter.
All right, take care.